Okay, so this is Mr. Warren George. In his main career, he was the director of primary operations for a Fortune 500 titanium production company. Following that, he was a financial management consultant for over a dozen years. He has given over 60 presentations on funding universal care in Oregon. He was a governor-appointed member of the Oregon SB 770 Universal Healthcare Task Force, which met from 2020 to 2022 and served as the vice chair of the current SB 1089 Universal Health Plan Governance Board during its launch in 2024. He will Today he will be explaining the bell curve of political perspectives and how successful campaigns need to respectfully involve both sides of the curve. He will also talk about the differences in vocabulary and attitudes between progressive and conservative supporters of universal care and difficulties of bridging that gap.
Thank you, Zachary. Um, uh, as I said, I mean for the discussion to be pretty open. I think it actually works. If you raise your hand, I will see it on my screen and can call on you, but also can stand a little bit of interruption. I really don't want to go past something if you're not following me. Um, because well, a lot of what I'm going to do is maybe different than other things that you've heard. I'm a Republican businessman, and I work with a lot of other Republican business people um, who see the world in a particular way. But I've also, for 10 years, I started um, groups of 8 each, called Unlike Minds groups, that got people from different perspectives, different backgrounds together in their homes once a month to understand why they were different. So I'm used to understanding different perspectives. So as a Republican business person, numerous progressive groups have asked me to tell them the secret of how do you talk to conservatives? Um, how do we get through to them? And why are they asking me to do that? Seems like a basic question, but I'd like to ask you, why would they ask me? Anybody? Yeah, Zachary.
We had a brief discussion about this, but it seems like in the United States, as much as we'd like to believe we're beholden to reason, there's a lot of people that are more have more ideology-based belief, and it's kind of hard for them to step outside of those, even if all the facts are countering that ideology. So maybe that's one of the reasons.
Anybody else? One of the things that seems fairly obvious to me, I mean, there's two things implied. One is that they think that Republican or moderate conservatives are an obstacle, and so it's not like they're blowing them off. It's that they truly don't know maybe how to talk to them. Um, but I think one of the things that it says is something that I believe is that you really do need to develop wider support. Um, Last year, I'd been giving this speech about how do progressives get through to moderate conservatives for a number of years, hadn't really gotten anywhere. And so last year I told Betty, I'll give the speech, but only if I can give it as a parody of how do moderate conservatives get through to progressives and explain the importance of universal care in a way that we can both understand it. Uh, this year, um, I actually will try to stick to some kind of middle ground. Um, and in a dispassionate sense, not that one side needs to change the other, but unless there can be some understanding that that we won't be successful in building a coalition together. Um, then once I develop the importance of there being a coalition, I'll talk a little bit about what makes people different. First, I always like to tease people's brains. When I was a kid, I loved this riddle. It took me a long time to figure it out. How far can a dog run into the woods? So don't think about it too much. And if you know the answer, don't tell anybody yet. I'll uh, I'll check with you later. Historically, successful strategies for change. Let me get back here. Successful strategies for change have a way of looking like the winning target depicted here. I've drawn a bell curve showing kind of a difference of people on the far left, far right. I've drawn, uh, put in labels like liberal and conservative. I don't like those labels. I don't think any of us are all one way or another, and we really shouldn't be. Um, but the by nature, change often comes from progressives. But until an idea becomes mainstream, including getting across party support from moderates, it's never become stable law. The winning target shown here is approximately the picture of Joe Biden's election in 2020. When he got cross-party support from moderate Republicans. And I believe that when true healthcare reform is passed by the voters, first winning state election, this is what will it most look like. I'll stop here. If you agree that this is the winning target zone, or do you have some different view? Um, and do you agree that the bell shape is a accurate representation of our political distribution? Okay. Uh, well, I'll throw in that some people might think that we're a little more bimodal, with people further to the left and further to the right. I like to think of us as a normal bell curve because that's what healthy societies are, and I'd like to believe that we have been and can be a healthy society. To illustrate the point more directly for the need for broad support for universal care, here is some actual polling data from Oregon. No political advisor will suggest that you go to the ballot box with less than 60% level of support before the campaign starts. The Elway poll of 2019 achieved 62% support, but it's important to understand where that support came from. Registered voters in Oregon are 35% Democrat, 25% Republican, 40% others, made up of about 8% third party, 32% non-affiliated voters or NAVs. Even though 80% of Democrats in the polls supported a universal care system funded by a large income tax, 80% of 35% is only 27 to 28% of the votes to be cast. This means that Democrats by themselves have less than half the votes needed to pass universal care or to begin a campaign. And even if we add in the others, that would only be 27 plus 25, 52%. Is still not enough. So there's simply no way to pass universal care in Oregon without about 40% support from Republicans. So what this means to me is that no campaign based on partisan identity politics can win universal care. And let me say that again. No campaign based on partisan identity politics can win universal care. Now, depending on your screen view, uh, there are basically four motives listed at the right. Party loyalty means that you can pay less attention to the details and you're supporting sort of an identity ideology. So if your party supports an idea, then you're for it. The To self-interest, it means that you're looking out for yourself. That's not a bad deal. Most of us do and should. But it means, oh, healthcare will cost less for me and my family, or I can get a new treatment that will cure a disease I have, or, self-interest isn't bad. It just, you're basically doing things for yourself and your family. Um, Altruism means that you're willing to accept a loss in benefits, wait times, or other items so that others will have an improvement in their care. And community control could mean that you will support a tax levy to buy a clinic or something so that it stays open under local control. These of the Democrats, Republicans, and other voters, they are a mix of these motives. And I guess something that kind of stands out to me is the Republicans the Republican support is clearly based on uh, self-interest motive or altruism or community, because their party is decidedly against democratic ideas of universal health care. And yet in Oregon, um, um, and this poll was designed to be nonpartisan. Our U.S. District 2, which is heavily Republican, um, voted 2-1, 2-1 for Trump in 2016, 2020, and yet polled 55% for universal care. Zachary?
This is just something that I want to pick your mind about, but I know Oregon specifically, the area around Portland and the western part of the state is almost exclusively controlled by Democrats. And as you go western towards Idaho, it becomes more rural and conservative. Do you think the like larger proportion of Republicans that support universal health care do so because rural health in Western Oregon just isn't profitable and they see like limited access? Or do you think and that's what's driving their self-interest? Or do you think is that something you've explored?
Yes, and I think you're exactly right. Um, and in fact, it's interesting that Republican support is lower in the Democratic dominated areas. Republican support is high in the Republican dominated areas. Um, and the fact that they are rural, um, uh, there are more problems with healthcare, more of a crisis in rural areas. Um, so anyway, you can kind of see that a goal here, if we wanted to get people to cooperate together, we would need about 80% support from Democrats, 40% from Republicans, and let's call it 68% from non-affiliated voters. That is a challenge because um, Republican support. This poll went out with the Republicans assuming that it was a Republican plan. if a critique of this given in a $60 a plate dinner where I presented the results in Portland. Well, he said, that's great. This is a nonpartisan poll, but in the real world, people take sides. So as soon as the unpopular Democratic governor, at that time, Kate Brown, endorses the plan, the Republican support will go basically to zero. It's that 38% is only something that can be achieved if they feel like that they are equal partners. So something that I worry about from the standpoint of current efforts, and this is I've placed where I think progressives are on that map of the territory that we need to cover, and this is I've done that based on counting Bernie stickers in the parking lots in Oregon of people who support people at rallies. Um, how many of the, let's say, moderate conservatives you think are Bernie supporters? I can tell you, not many, very few. And by the way, I've shown this to a lot of uh, uh, progressive groups, and they all seem to nod and say, "Yeah, that's about where we are." And they say, as soon as we can convince those moderate conservatives to become progressives, we'll have our majority. But I can tell you that's not going to happen. Um, Similarly, when I'm saying that we're positioned a little to the left, here is looking at national campaigns for single payer. It's based almost entirely on progressive politicians who admit to identity signaling rather than trying to get the bill actually passed. Here's a graph of the 435 members of the U.S. House of Representatives in 1922, govtrack.us, grades each one on a series of issues, liberal to conservative, and then notes their success at getting bipartisan bills passed. And of course, I'm saying if universal care is going to pass, it's going to be passed as a bipartisan effort. The House champion of Medicare for All, Pramila Jayapal, is the sixth least effective representative at getting bills passed. The champion of state-based Universal Care Act, Ro Khanna of California, is about the same. When you look at these, somebody might ask, who's that? Who is it that gets bills passed? That's Amy Klobuchar from Minnesota. But many of these other people who are good at getting bipartisan bills passed are actually Republicans. So the question for me as a conservative, just let me get rid of this here. Yeah, the question for me as a conservative supporter of universal care is, how do we close this gap, or even is there a gap? But I represent myself as the green dot there, and how do we get together on this? I'm really a believer that we're about to go off a cliff with big consequences if we do not put together a coalition that it puts universal care in place. So I'm going to now present a little information. Of course, commissioned the Elway poll. sometime back. I have knowledge from um, running unlike minds groups. And also, about 10 years ago, I played a game that I called Red State, Blue State. And what I did is I looked up a whole lot of statistics um, after the 2008 election between John McCain and Barack Obama, which everybody told me was the most divisive election that America would ever have. um, huh. uh, I began wondering about the differences between the states, looking at various statistics. Um, so here's the first one. Um, so in my playing this game of red state, blue state, one of the first data points I randomly came upon was the annual divorce rate for each state. Here's a picture of my hand notated graph at the time, which plots the divorce rates of the states against percentage of the vote for Barack Obama. You can kind of look at the 50% mark and say the states to the left are red states and the states to the right of 50% are blue states. So this graph blew my mind. Disregarding Nevada, which I think most of us understand is the divorce capital of the world, um, there is an obvious correlation between divorce rates and who voted for and who you voted for president. But why? And doesn't that seem backwards? I mean, it certainly seemed backwards to me. Aren't the red states the one that preach about family values and that sort of thing? Well, I eventually figured it out. You actually have to get married in order to get divorced. Uh, Hang on. Peggy, can you get that? Sorry. uh, so there's actually the marriage rates are substantially lower in the blue states, and that's what's leading to lower divorce rates. But now let's get down to the nitty gritty. So what do political parties really sell? Um, they, we all want to feel a sense that we're the right people and that our superior thinking gives us an advantage over an inferior opposition. So now what do we do with this? We have two groups who are claiming superiority, but they're kind of looking at very different things. I mean, anytime you have a different from somebody else, that gives you the advantage of being able to give yourself the benefit of the doubt. But here are two examples where the blue states are saying we're superior because we have more advanced degrees. And we have people in the red states who say we've been following a moral pattern for thousands of years, and that gives us the moral superiority. There is a story, and I love this story, in a book called How Real is Real, where at a psychiatric convention, they found two psychiatrists who didn't know each other. And they told each they were asked each if they were willing to talk to someone who had a severe delusion that they were a psychiatrist. And so they set them up in a room to cure the other of having delusions psychiatry, of being a psychiatrist. Um, well, it was eventually one figured out that he had read a paper written by the other. But this is not that different. We are set up to try to find superiority over each other, but it really isn't that simple. And are people with advanced degrees really smart? I don't think that's, if up in the upper right-hand corner of that graph, if DC is the smartest place in the world, I'm not sure that that holds, that education always makes people smarter. Is church attendance a perfect evidence of moral superiority? I don't accept that. But yet, this is a difference between those two groups. So another thing that is dealing with some kinds of stereotypes. And this graph basically shows that it's not hard to compare, let's say Connecticut to Mississippi. And so in general, the higher the vote for Obama, the higher the income. So we're actually looking at the blue states having about 20 to 30% income advantage over the red states. And when we look at IRS data, I spent a lot of time poring over IRS data, and charitable contributions average per return climbing. There's actually the blue states give about half as much to charity as the people in red states. And this is true at every income level. Can you think of some reasons why this might be true? Okay, Zach, go ahead.
Uh, I know on average we were talking about it, but red states tend to have less social programs, so maybe they feel a bit more of a social obligation to help people through charitable donations, especially when there's higher rates of poverty in states like the South or Mississippi, Louisiana.
Yeah, this actually, when you add up the higher social tax rates in the blue states, they're actually both paying about even, but there's far more um, contribution to churches, more charity through churches, for instance, in the red states. But what do people in the red states, when they see a graph like this, what do they assume? They assume that people in the blue states are just not willing to pony up to, uh, but it's largely a different view of the role of government. Looking at other differences, Elway poll offered each respondent an opportunity to describe why healthcare costs so much more in America than it does in all other countries. The words favored by progressives for why healthcare costs so much more in the United States were profit, greed, and CEO pay. In their answers, progressives tended to use the word profit as an insult synonymous with greed. This is very different from moderates and business owners who see profit as how they buy groceries. Um, so, okay, now, meanwhile, in the poll, um, moderate supporters of universal care used words like, there is waste and utilization issues in our system. There are system inefficiencies in our system. Um, our system has incentives to overtreat. Um, and these are two very different kind of mindsets. And one of the things that I noticed here is that the progressives are using words of that kind of that are blame of someone else doing something wrong, where the moderates are saying our system needs fixed. Um, and that is it turns out to be a somewhat profound difference between the two groups. Um, Meanwhile, and it gets back to the uh, role of uh, role of government. Um, Moderate supporters of universal care blame government for high cost of health care. Um, Progressives tend to blame insurance companies. And there are reasons for some of this. We might get into this later, but business people particularly, and in Oregon, 66% of Democrats get their care from an employer. In Oregon, only less than 30% of Republicans get their care from an employer. The rural areas particularly have very few employers who offer health care. So Republicans tend to know their insurance agent, and they like and trust their insurance agent, where progressives tend to be getting insurance through their employer. Um, but I'm taking a moment here just to show Oregon has done some major studies and actuarial consultants that actually showed if you look at insurance margin, actually profit is a very small part of the system or of changing to universal care. And in fact, it may, they identified about 1.5% reduction in cost due to removal of insurance company profit. But they forgot to add in the cost to the state of reserve costs. And so they're basically kind of wash. So in Oregon, what our consultants told us, our actuarial consultants, was that we can save quite a lot of money, but it's not from eliminating the insurance company. It is from simplification, because up to 20% of the inefficiency is coming from the provider side, spending too much time on coding and chasing down bills. And here's a graph that shows, this is from National Health Expenditure Accounts, shows that over time, the insurance company cut has actually been going down over the years. And now those two lines on the bottom, government is becoming less and less, started out as very efficient and is becoming less and less efficient as government turns over many of its functions to private companies. For instance, Medicare Advantage programs. Um, so yeah, I think I got that one. Everybody hates pharmaceutical companies. There's no argument about that. So what other differences in vocabulary? I served on the governance board, and the governance in Oregon, the bill although I worked on the bill, it was largely driven by an organization called Healthcare for All Oregon. They showed up at the first meeting and they told the board, um, uh, concentrate on values and stories. Details frighten people. Um, I joined the group believing that we were going to form a cooperative public corporation and that people will not sign into that group unless the details are well laid out. Uh, Here's another example. Here's me's. I was invited to speak on May 31st, National Single Payer Day. Invited to speak along with our um, uh, uh, Democrat state representative. So the two of us shared the stage, arguing for universal care. She as a Democrat and me as a Republican. Um, there's something to be learned from this. When I was asked to do it by Mid-Valley Healthcare Advocates, here's the flyer that they told me people would be invited to speak. And I said, yeah, that looks great to me. Then Healthcare for All Oregon said, no, that flyer is not exciting enough. So they revise it to say, show up in Corvallis to demand universal health care. So this brings another another difference between progressives and moderate supporters of universal care. Progressives, they make demands. They've told the governance board, don't come up with any details. You'll be giving up power. We want to negotiate. We want better for ourselves. And actually, the speech that I gave at the courthouse was universal health care is based on our need to recognize a problem and cooperate. Then, as if that wasn't enough, Healthcare for All Oregon um, uh, added a whole lot of, by the time I actually was speaking, I was speaking under the banner of Oregon Working Families Party, Healthcare for All Oregon, Healthcare Workers for Palestine, Veterans for Peace, Oregon Nurses for Oregon Nurses Union, Bernie PDX, Jobs for Justice, and Democratic Socialists of America. Wow. I probably wouldn't have spoken if I knew that I was going to have all those banners. So progressives tend to use a multi-message platform, and whereas moderate supporters like myself, let's say, let's stick to a single issue, we're likely to lose people the more extra banners that we add. So here's another pretty typical one. Um, um, Progressives say healthcare is a human right, and more moderate supporters say healthcare is a critical resources which needs to be managed efficiently and apportioned fairly. So another thing that has come up in Oregon, there's a lot of people who say the wealthy must pay. Moderate supporters are going to say, my goodness, the wealthy are already paying for the majority of healthcare. Here's a graph that shows, yes, Therese.
Yeah. Sorry if this is a little off track, but I was wondering if moderates prefer, like in terms of terminology, do they prefer hearing like single payer or universal health care or like Medicare for all? Like, is there any differences in how it's presented?
Oh, thank you very much for asking that. They are very encouraged by the phrase universal care And in the poll, I said that we worked hard to be nonpartisan. We couldn't use the word single payer because that is more or less branded by the progressives. So we used things like one clearinghouse uh, to get around that. And yes, um, the conservatives or the moderates tend to not like single payer because they associate it with progressives. And just like, it's unfortunate in our society, but if something comes from our enemy, we're not likely to, uh, to think that it's something for us.
And Medicare for all, is there like, do they feel a specific way about that terminology?
Yeah, and the problem is probably Bernie.
Mhm.
Uh, well, it's twofold. It's Bernie and it's government. And one of the things, I didn't put it in my slides. Thanks for asking, but um, the progressives tend to be very oriented toward federal legislation, federal action, whereas moderates tend to say the best healthcare we could get would be a local healthcare district that we would pay into and vote on. And so and it's, each of those has its advantages and disadvantages, but there's a strong difference. And yeah, thanks for bringing that up. Anybody else have anything while we're here? Okay. Um, Back in the 1950s, the number of people who was less than 5% of people who couldn't pay their own healthcare bills. That was because healthcare was pretty inexpensive, and a variety of things. But starting, like in 1965, well, actually, after World War II, there were county programs that provided charitable care. And anyway, gradually by 1970, we've actually got like 80% of the people. It's pretty easy for like 95% of the people to take care of 5%. It is by 1970, we've got a situation of maybe like 90% of the people trying to take care of 10. Um, by uh, by 2010, we're actually up to about 66% of the people trying to take care of 33%, and proposals that were made in our task force would have as much as 50% of the people paying nothing for healthcare, all funded by the other 50%. Um, and so you say, okay, so there's a gradual trend going on. And there are some people that says, oh, we're reaching nirvana where no one has to pay for anything. I don't think it works that way. And we're actually, I mean, to me, we're approaching some kind of a collapse, among other things, where we just can't go any further in that direction. Done calculations for the state of Oregon. Here's a graph showing the 6 sources of how we pay for healthcare. We cover cash, that's our out-of-pocket expenditures, pay through Medicare premiums, private insurance. Donations are actually a significant, like 5% of the cost of healthcare is covered through charitable donations. Then we got Medicare taxes, and actually the largest single source is income taxes that fund all of Medicaid and half of Medicare, because Medicare is only half self-funded. So here we've got, showing that for people in the highest quintile, their they're already paying for more than half of healthcare. So now going back to this graph, I've made a point, and I'm just going to no, I don't want to lose my place. Anytime you do a poll, one of the tricks that pollsters use is to keep asking more and more questions, adding more details, and seeing when people drop out. So at the end of adding all of the details, the Democratic support had dropped down to about 68% from 80. The Republicans had dropped down 3 points. Interestingly enough, the other voters, and specifically the non-affiliated voters, got more excited the more they heard. And this could be due to some differences. Older voters, well, first, NAV voters tend to be younger. Older voters are very afraid of things like, oh, socialized medicine. Oh my God, who made a bad stink in the room, and so they have a bias against that. But actually, non-affiliated voters got more and more excited at the possibility of things like publicly owned clinics that provided care. Here's another depiction of that, of looking at the pollster's view of how soft various kinds of support are, and we see progressives lost about 12% as the poll got more detailed. Democrats lost a lot. Republicans, the ones who supported it, were more loyal than progressives or mainstream Democrats, but the non-affiliated voters just got more and more excited. That's extremely unusual in a poll. So covered some of this, looking down the second from the bottom. The healthcare as a human right is a big phrase for progressives, and healthcare is a critical resource, needs to be managed efficiently and apportioned fairly. The way that these two groups view each other, unfortunately, and I don't think, progressives view conservatives and business people as uncaring. Here's this need. Why are you not out here carrying signs with us? And progressives are viewed by moderate supporters of universal care as simplistically impractical and unaware of actual financial realities. We're spending a lot of time in Oregon. We're trying to figure out a tax that everyone will like, but it's fairly clear that most people feel that the only fair tax is one paid by someone you don't know personally and probably wouldn't like anyway. They're debating out here, how do we get more tax on alcohol? And of course, that is basically a tax on the poor, unfortunately. But it's the idea of let's tax someone else. So in summation, there are, what I've discovered is that there really are significant differences in vocabulary and perspective between progressive and more conservative supporters of universal care. And those differences really are pretty profound and include kind of the difference of, are we outside of the system pushing the system to do the right thing for us, or are we all the system making a decision amongst all of us? The hope, of course, is that we can abandon our current senses of imagined superiority and just look at the problem. And a story about looking at the problem, I think, comes from Connecticut. I don't know if it's true or not, but I love the story. There was a bridge that collapsed in the middle of the night, and a car was coming. This is on a freeway. A car was coming, and it saw the bridge collapse and was able to stop in time. And the driver of that car ran up backwards up the freeway, running at every car and screaming and yelling at the cars to try to get them to stop. And to his horror, the cars went off the edge, whole families, with the driver not even looking ahead, but looking over their shoulder at why is this person in the freeway screaming? Then he thought, after 5 or 6 cars had gone off, he thought, I need to try a different tactic. And so he stood in the freeway and with his back to traffic and held his hands over his head as if he was looking, and looked at the problem. And they stopped to see what he was looking at. The lesson here is that we need to stop running at each other, and we need to put all our energy into looking at the problem. So the answer, by the way, does anybody know the answer to this riddle? Okay. A dog can only run halfway into the woods. After that, he's running out. So one of the things that we all have in common, it is a desire not to keep kicking a can down the road to in my case, my grandchildren. But we need to start ticking the can't out of our vocabulary. So I'll stop there, and I'd be curious to get your reactions on the, oh, Mackenzie, you're visible now. Yeah. So let's start with first question. Go ahead.
Why do you think that there was such a drop in support after more details were shared? And how do you think what do you think is the best way to balance the messaging so that you're gaining the support of the non-affiliated voters while also retaining the base that was already there?
Well, and that's an excellent question, and I see a couple of things going on here. One is, when we're highly partisan, we've each coached ourselves that we're going, people have said, are telling the progressives, oh, you're going to get all kinds of free stuff, and the wealthy are going to pay for it all. And so, I mean, whatever you've been told, or, if you're on the other end and you've been told, boy, if we can get control, we'll get those deadbeats off of welfare and go to work, or something. And when you are expecting a message and you don't hear it, then that's a letdown. I do think, for me, the idea is that if we all combine together, first, I reject the idea that we can solve this as separate groups. I think we need to kind of create a new foundation together, without different groups being ahead. I think the progressive drop is, if you've been told we're going to win this by crying as hard as we can, and one of the things that happens that was very evidenced in the Elway poll is the Democrats over exaggerated the problem. They had the best insurance, but they said they had the worst situation. The Republicans didn't have very good insurance, Twice as many of them said they were happy to have it. And so this idea of, are you anti-establishment, pushing the establishment to do something, or are you establishment? Do you accept yourself as being establishment and that we can do something? Is the messaging that I believe that we need to get to. That doesn't mean I don't have sympathy for what many of the their progressives are saying. Let's leave the details out. Stick to the values and stories. Some of those stories bring me to tears, and we need to solve those. But I think unless we can agree that we need details, we're not going to get anywhere. I know that didn't touch everything, but if you've got another way to rephrase that might get a little more.
So that was good. Thank you.
Okay, thanks. Natalia.
Hello. I'm wondering what you think. So it feels like we're increasingly polarized these days, and each side is only watching like one thing. Like it's like, oh well, all of the Republicans are watching Fox News and all the Democrats are watching like who knows what we're watching. You know what I mean?
Yes.
So where do we go to find that middle ground where we're talking details and we're putting aside, like, how do you get people to listen when people are only turning toward the thing that's most dramatic or exciting or like horrific?
Um, Thank you. And it's not easy. One of the things I learned from running, I guess, 8 unlike minds groups, that people never really changed their minds about things. But by the way these groups work is every group could pick a topic once a month and would meet in each people's houses, which by itself is, taking your shoes off and putting it with other people's shoes and things like that puts you in a non-anonymous thing. But as each person gets to explain, here is, whatever the topic is, immigration, or, here is what shaped my understanding, that something kind of magical happened, that people didn't change their minds, but they begin to soften their disrespect of others. And I think that might be about as far as we can get for a minute. We're in a time of really unprecedented change, and of course that is going to bring out the worst of us in saying, the who moved my cheese. Everything was fine until you did something. I know when I wake up in the middle of the night um, and I stub my toe on the coffee table in the dark, I assume that my wife moved it so I would stub my toe on it, and that's kind of the way that we're behaving, and it's going to take a little bit of that, take a little bit for that to unwind. But I think focusing on the problems um, can help. Um, the the choice of news sources to me is kind of tragic. One of the things that we did as a project for Unlike Minds Group is that everybody in the group had to uh, change their uh, change their news source for 2 weeks, and uh, I had to listen to Rush Limbaugh for 2 weeks. Found it pretty difficult, but I began to, a lot of things are, um, one of the things I've learned as a business manager is to stop listening to what people say and listen to what people feel. And so, we've got progressives who saying, how in the world did we get to a place where um, 40% of our population shares 5% of our income. And how can we live that way? And well, anyway, the idea is that, and on the other end of the scale, the Republicans keep hearing things like I've heard it myself. We had a contractor who was going to come do work on our house, called the morning of and said, "Oh, we had a new employee, two new employees, but they both decided not to take the job because they could get better benefits on welfare." Well, that's a sad situation, and both are real, and both are kind of perceptions or feelings. You really need to um, understand that people who say things, most of them, I'm not sure all, really are feeling something that they're trying to express. And the more that we can do to honor those and say, your words don't make any sense to me, but what's behind that? Uh, so, okay, I need to move on. So thank you, and Caitlin.
Hi, thank you. I just wanted to say that also I really enjoyed your talk. I think I got a lot from hearing a different perspective, and I thought a lot of the points that you were making were valid. I agree with the fact that I think that this issue, universal healthcare, shouldn't be so politicized because it does affect both sides, and average Americans on both sides have suffered from these policies and the price gouging and all of this, and it was really interesting because it sounds like there are people on both sides who are agreeing that this is an issue, but it's almost I don't know if hatred is the right word, but just the enemy mindset is just holding us back from making real progress. So my question to you is, personally, what made you a supporter or first opened your eyes to universal healthcare? And also, how do people in your party who may not agree with universal healthcare, how do they react when you kind of talk to them about it?
Well, I think, and I really appreciate the question, and but I'm going to, pick on a little bit of a different perspective. You said what opened my eyes. I I came up with the concept of single payer long before I knew that other people were advocating for it. And myself and other business people, have tried to lobby for it, and then have had to kind of back off when it became a uh, political thing. Um, the There were three sponsors, uh, who helped me commission the Elway report. All of them were Republicans. The company that I worked for said, this is a international company that was bought out by an international company. They said, we're for their vice president of human resources. We're for single payer, but the fact that the discussion is being controlled uh, politically, there isn't much we can do, and particularly since, when people say we demand, this is business assumes that they're being targeted. And so business, there's a lot of support, and always has been, or I shouldn't say always, but has been for at least a decade. But like in Oregon, we have had great um, boards and things to try to figure it out, on which I've agreed to serve for a while. But Um, but the sense is that business can't live without with uncertainty. So the fact that the progressives are saying leave the details out of it, business is just lying back in the weeds. I could make a case that business was the first supporters of single payer. But my interests are to try to forget who owns it and implement it as a matter of and maybe what we would actually implement. It wouldn't be a perfect single payer system, but we've got to do several things to make the U.S. better because we're headed in some pretty bad things. Does that help? And I hope I didn't make you feel uncomfortable by turning the words back into a different perspective. But does that help?
No, yeah, and I appreciate you correcting me because that also is interesting because it just kind of shows how the perception I have of how little support that there is from the conservative side. So it is interesting that, you were kind of advocating for it a long time ago, which shows that it really shouldn't be such a politicized topic to begin with. Um, but I guess if I could just ask one follow-up question. It's just that when I see information online and polling, it just seems that the results are always that there's more support for kind of universal healthcare or single payer on the Democratic side as opposed to Republican side. So I was just wondering, I guess kind of why that is. But I know you did hint on it getting more politicized, but I don't know. Do you think that there are more conservatives that agree with
Well,
this?
the Democrats and not the Joe Biden Democrats, but the Bernie Sanders Democrats, of course, have embraced this as their own. And so, the fact that many of us belong to sort of social loyalty groups uh, that are going to support it, that's going to explain some of the higher support. Certainly, the fact that Democrats embrace government action, um, where I mean, actually, some of the ideas that we've had as business is, how do we as business people contract with a local healthcare provider to take care of our people? Let's do something in a more efficient way than going through insurance companies. And so not all business is going to embrace government. And we've had terrible fiascos in the government in Oregon where at the implementation of the ACA, we spent $200 million on new software that didn't work. $200 million down the tubes. And that is a black eye that government in Oregon is going to have a long time outliving. Um, I would say that there's probably other reasons why Democrats poll higher, and that's there's some people who use the I'm almost embarrassed to say it, but the model of the loving mother and the stern father. That there's two sides of society, one which is can't stand to have a crying child, and the other who says if you don't do your chores tomorrow, I'll give you more to cry about, or a very different kind of approach. And I think that is a little bit true of the Democratic Party. Is its whole background comes from looking out for the disadvantaged, and has done some great things in that area. Unfortunately, now that Democrats, largely because of their better education, have higher incomes. the idea, I said in 2012 that the Democrats had deserted the lower class, and that would leave the Republicans room to win in 2016. And that is what happened. Trump, came into all the people in the Rust Belt coal mines and said, "As you see those overeducated fools, they took your jobs away, and they didn't leave you anything and have no sympathy for your plight." Um, and I guess I would like to see both parties not using that as a ploy, but really saying, my God, do we have, how do we make a more um, uh, participatory economy where people, instead of trying to solve problems with subsidy and charity, that we solve them by greater participation in the economic sector. One of the reasons, incidentally, why healthcare costs more in the United States is specialists make about 5 times as much as other countries. Primary care docs make about twice as much. Nurses make somewhere between 15 and 50% more. Um, and so that is one of the three major causes of higher cost in America. But it's the problem isn't that medical people get paid more, is that our differential between what we'll say educated workers um, versus manual labor has just become it doesn't make any it's bad in the end that we have much more spread from high to low than other countries. You go to Sweden, a burger will cost you $20, but the workers in the uh, in the burger place can buy their own health care because they make enough to do that. So, so I hope that helps. I do want to uh, move along. Zachary.
Well, first, thank you, Mr. George. We do want to be respectful of your time. Was there a certain time that you were expecting to get out, or are you okay with these last two questions?
I'm quite okay. I've got another 20 minutes at
Okay.
least, and I did have slightly more material, but I'm enjoying the conversation. Um, so,
Okay.
McKin-
Or,
McKinsey.
or
Oh,
I have a question that I'd like to ask. If
oh, I thought you used your coupon on the, no, but go ahead.
No, I didn't know if we were keeping you from something. Okay. So my question is about a bill that passed recently in Oregon. It's the Senate Bill 951. And then just so people have some background on this, so we haven't gotten to it yet, but private equity has had a role in like bankrupting, I think, two hospital systems now, and they're acquiring physician practices, specifically anesthesia and emergency medicine practices. And there's been some decreased patient outcomes after private equities acquires a physician practice, but Oregon is actually the leading state on combating that. And they recently passed, and their governor signed into law Senate Bill 951. Uh, and their explicit goal was to ensure that decisions in exam rooms are being made by doctors and not corporate executives, which I think is something that's important to all of us. But the question I have to you, Mr. George, is if you know anything about how that was passed, and I know corporate interests in the healthcare industry and pharmaceuticals are obviously very important, big donors, and how the Oregon legislature was kind of able to put those to the side and be like, this is a problem facing our constituents. And it seemed to pass with pretty broad support. And I just wanted to see what, if that was like a master class of what you're describing of bipartisan support or what happened there.
Um, Yeah, first let me say I haven't contributed. I've been following that legislation, but I haven't contributed any of it directly. Um, my belief is, I mean, I'm just speaking. Well, let me say something first. There's a lot of people who are very optimistic about this, and I don't want to do anything to dissuade that optimism. I can tell you that I foresee problems with this legislation, which when you put a whole lot of regulations on private companies who are barely making any money, um, the only people that you will have who will do the job are dishonest. And that's my fear. Um, and I've worked for dishonest corporations who, oh, how are we, how are we going to stay in business this month? Well, uh, they have lawyers. I mean, they're good at avoiding regulations, and the way that they're getting around this regulation is things like, oh, so only doctors can, let's say, own a clinic. Well, the way you do that is you say, okay, we've got 100 doctors here, and we're going to pick 2 of them and say they own the clinic, and they get to make all the decisions. We handpicked them. Uh, so that's my fear. But my answer to that, emphatically, is, and I've have some things going where, particularly rural hospitals that are in trouble, trying to get voter levy supported buyouts to actually take over those clinics. I mean, the only way that, if you want control, the only way you can be in control is to own it. And so I am a big fan of public health districts owning clinics and hospitals, and uh, for the benefit of the community. Now let me go back to the part where I said a lot of people are very optimistic about this, and I'm anxious to see how it works out. I hope it works out better than my fears. Now, Mackenzie.
Hi, thank you so much for this talk. I found it very, very interesting. I actually did my bachelor's in business management, so it's been very cool to kind of hear a businessman's perspective on the whole thing. My question, you kind of actually just touched upon it a little bit, but you mentioned there was one slide you had about how the benefit of changing the healthcare system to single payer comes more from the simplification rather than the governmental control.
Yeah.
Do you see any kind of viable option in simplifying without making it governmental control? And do you think that that kind of option would appeal more to conservatives, or is that not something that you consider?
It's in the hopper. And, the real question is, and one of the things that maybe I didn't say enough about, the difference between, conservatives particularly, they want choice. And it, ironically, to give you an example, we've got about 6% of Oregonians that are uninsured. And, you talk about the messaging of who's that going to appeal to take care of those. Well, the Democrats love the idea of going in and rescuing, these uninsured people. It, when you actually do the numbers, about 3/4 of the people who are uninsured by choice. They like the idea of high deductible insurance that doesn't qualify for the ACA. They like the idea of Christian cost sharing. They like the idea of paying cash for the services they want and not paying for other people. So that is that is still a problem. So let's say we could go in and we could say, and I've written letters to the insurance companies saying, look, you've got the answer here. if you will just agree to one standard plan, one risk pool, no fighting over whose patient is whose, we can save substantial money here. And their answer is no. People want choice. People want to all be able to have every one of their insurance policies be tailored to them personally. So that, I think, is one of the biggest obstacles. I think it could be possible, Mackenzie, that through state legislation and the states can regulate insurance for most things, to just say, if you want to sell medical insurance in Oregon, it's going to be follow these standard rules. There's going to be one clearinghouse for paying bills, and insurance companies can more or less compete by service or something. But I really like the question, and it's kind of thinking that I wish more people were doing, because not many people have responded as you did as quickly to see that slide and say, there's another answer here, and there is. And one of the biggest problems is that the ERISA Act of 1976, Employee Retirement Income Securities Acts, allows employers to become self-insured, and that self-insurance is not defined as insurance. So the state can't regulate it. And so unless you get the buy-in, not only do you have to get some buy-in from the insurance companies, you have to get some buy-in from the self-insured employers, which might be there. But many politicians in Oregon, when you look at their funding, their campaign funding, people who have an interest and a lot at stake can wreak havoc, and it has in Oregon, with many people rising to high places who are tied to insurance companies, and even Democrats who buy into the idea of freedom of choice, that everybody should be able to game the system to their advantage. So keep thinking that. Mackenzie, really, really appreciate the encouragement on that, because I think it could even bypass a lot of the difficulties if we could get the right people to agree. Thank you. Did I cover that?
Yes, thank you so much.
Okay. I do have just a couple of minutes more material that I can cover if your eyes are glazed over already. It is Friday afternoon, my goodness. So I could ask if you want to see a couple more slides. Okay, let me do a quick share here. Here is basically, I've been using this graph. I haven't updated it for a number of years. The numbers are actually higher now, but this is a depiction of what healthcare costs in the United States versus other countries. So it's surprising to me that more people aren't asking, why does healthcare cost more in the United States? What really makes the difference? Well, a study that was published in JAMA toward the end of 2018 by Dr. Irene Papanikolaou, a London School of Economics, said that there's basically three reasons why healthcare costs more in the United States. First, as far as a baseline, it's like we're getting the same $5,500 worth of services that everybody else is in the world, except we're paying 2.5 times as much for higher drug costs for the same drugs as other people are using the same amounts of. We have mentioned about the higher labor costs in the United States, which is kind of a function of how we value, and the problem in the United States is we're using high value labor to take care of low value workers. And that's, other countries don't have that problem. And then we're paying about 10 times as much for higher financial admin. And that goes back like to that simplification. If we could simplify, we could get rid of that. So, with a single payer system, it can't maybe directly address the higher labor costs or higher drug costs, but it can. I mean, it's designed to go straight after the higher financial administrative costs. So that's, a lot of people say, what's this single payer system do? And that's basically what it's designed to do. It still doesn't get as close to what other countries pay unless we address some of the other costs. And by the way, I'm not, there's two ways to skin a cat. I'm not against raising the income of the bottom half, which would be another way to kind of solve the problem. Is we've got such a high differential between the value that we place on some people versus others. Okay. If there, yeah, Natalia.
I just wonder what you think about the fact that medical education is so expensive in the US and education in general. So a lot of people are coming out of their training with really a lot of debt compared to a person who goes straight into a trade or something like that. And so do you have an opinion on how our education system could change or some other way of approaching that problem?
Well, I can give you the answer that's in the JAMA report by Dr. Papanikolaou. She said that when you add the higher costs of the education, it counts for about 2 years of higher incomes in the U.S. I mean, like if, for instance, if specialists, I'll go to the extreme, if specialists make $400,000 more a year than specialists in other countries, that's going to eat up. It doesn't take very many years of that to make up the difference. I do think that and of course this group would be the right group to point to this as a possible issue. The countries that I most admire actually pay directly for the education, and so that you don't accumulate that debt that's specific to medical professions. I think France is like that, and some others. So, yeah, I think that is an issue, and and I think the worst part of that is when you're deciding what to do with your life, being faced with this kind of taking on this horrendous debt and risk. When we have a shortage of shortage of primary care physicians and things like that is a really stupid way to design a system. So I accept your question and support the okay, Zachary.
Yeah.
I think we've got I'm feeling a good but a little tired vibe. Uh, and I really appreciate, like I said, I don't really want to change anybody's mind, but or make you think different, but I want to give you some different things to think about and in kind of understanding other people's perspective. And if are we required to be here for a certain amount of time? I can come up with other jokes and riddles.
No, I think we're good to go. And again, just want to thank you on behalf of all of us for taking time out of your day to speak with us, and I hope you enjoy your weekend.
And all of you, and good luck in your careers. I, I would be happy to think in the future that you can solve my health problems. So, thank you very much for listening.
Thanks so much, Mr. George.
Thank you so much.
Thank
Thank
you.
you.
Thank you.